Good afternoon. How are you? Hope everybody's well today. I'm here with Lillian from the health center. We're just doing a quick update on the situation of the COVID. We were lucky enough to make it 6 months without a case on the nation or any nation members affected. We're just bringing this out to membership. With the recent outbreak in Saddle Lake, we would like to just inform you guys, our nation members, that we are currently working with the health center to do the best we can to keep our nation members safe as chief and council and with the health center and the EOC team. We've been doing our safety checks on the nation. If you come to the nation, it's by appointment only to the office. You got to check in at the front desk, get your temperature checked, sign in. It's more of a monitoring on our behalf. So just
yeah, and I think I'll just jump in there for a minute, Roger, and just emphasize. So, it's business as usual for the most part around the offices. The workers are still in the offices and they're still doing the work, and we're just finding a different way of doing work. But it is important that when you do call in and make an appointment and come into the buildings, that you do actually, in fact, sign up on those sheets. That's a very important piece for us in the health building. In case we do get a COVID case out here on the nation, it just makes things a lot easier for us in doing the contact tracing and finding out who has been exposed, who hasn't been exposed. And so I just really want to emphasize that it is really important to make sure that we're following all those protocols that we've set in place with our band buildings. So I just wanted to jump in there.
And if in the worst case scenario, if anything what was to occur, we would be implementing our security checkpoints again, along with our curfew, just to monitor the situation. But for then, knock on wood, that we've been okay so far.
Yeah, so we've met with Chief and Council, and our EOC team has kind of been waiting in the wings in case we do have to deal with COVID on the nation here. And so we have discussed that perimeter security would be enforced again if we do have one case on the nation. So our threshold for, reactivating our EOC team and reactivating our perimeter security will be one case on the nation. And I hope that we never ever get there, but we always want to make sure that we have a plan and are prepared, and we do. So at that time, I'm sure the chief and the council will address you again if we do get a case on the nation. Just kind of going back to where you first started with our conversation, Roger, and where we're at so far, I think it's really good that we have to note here, we're 6 months now into this pandemic, and Cold Lake First Nations has done exceptionally well. You guys have followed the protocols. You have made sure that you're aware of yourself and your surroundings. You're wearing your masks. I see you out there all the time. You're wearing your mask. You're doing the hand sanitizer. All of our businesses have been very good about putting all that stuff out there for us to utilize. And I just want to commend you all for doing that. But that being said, we are starting to notice those numbers going up in Alberta right now. And so I think a lot of that is that COVID exhaustion, right? We've been battling this for 6 months, and it's been a long 6 months. And we just want our normal lives back. And unfortunately, we still got a ways to go. So we still need to be vigilant. We still need to follow those protocols, right? We still need to make sure that we're sanitizing our hands, that we're practicing that physical or social distancing. And as best you can, just be aware of who you're talking to. And if you're sick, for God's sake, stay home, please. and as well, just to let it be out there for you guys, I know we get calls all the time. Are you guys doing COVID testing on the nation? Yes, we are absolutely doing COVID testing on the nation. It's available to every last single member on the reserve. All you have to do is give us a quick call. We get you in, it's done within 30 seconds, and you're out the door again. And test results, if you're symptomatic, we get the test results back a lot sooner, usually within about 48 hours. If you're not symptomatic and you're just doing it just to be precautious, the results can take up to 10 days to get in. So I just want to encourage you guys, the more we test, the better information we have on our community here. Mm-hmm. So don't be scared of testing. It's a little tiny throat swab. It tickles the back of the throat. It's easy. It's quick. Like I said, the more we can test, the better information we have out there for our community.
And just on another note too, the flu shots, for anybody who's interested in getting the flu shot, Lillian and her staff will be doing them.
Yeah, so I've got a little information here in regards to flu vaccine. So out of all the years, if you've ever considered getting a flu vaccine, this is the year. I really want to emphasize that with each and every one of you. The one thing that we want to avoid is having like a twin-demic of influenza and COVID-19 circulating at the same time. So we have the ability to minimize the one, and that is influenza. We've had a vaccine for influenza for years. It's an effective vaccine. So I want to encourage each and every one of you, anybody from 6 months of age to the elderly should be getting their flu shot done this year. I have ordered more vaccine for our community than I ever have before, and I really hope that you guys take advantage of that. Although we're not able to do mass clinics this year as we have in the past, we have our plan going forward with flu vaccinations at the health center. So you are going to have to call, not so much book an appointment, but call ahead and just let us know that you're coming. We're going to get you in as quick as we can. We'll call you in as we do those flu vaccines. It'll be one at a time, but we're still going to be able to hammer them out quite quickly. So again, please, if you are all interested in getting a flu shot, make sure you get in and get it done. Our flu vaccines, we expect to be delivered to our community on October 13th. We should be available to our high-risk group, which is our elderly. Anybody with chronic health conditions, we usually offer our flu vaccine out to them first. And then our general clinics will be held October 17th and after that. Again, during normal working hours, 8:30 to 4:30 Monday through Thursday, and then 8:30 to 2:30 or 2 o'clock on Fridays. So if those times don't work for you for whatever reason, please let me know. We're very flexible. We'll make whatever needs to work for you and your family. But I really want to emphasize that it is so important for you guys to get this flu vaccine this year. Now, there's a lot of myths out there about the flu vaccine as well, and I think this is an ample time to dispel some of those myths. So I hear a lot of people saying, well, I never get the flu shot because I got it once and I got the flu from the flu vaccine. Roger. Mm-hmm. And I can honestly say that is not possible. So the flu vaccine is actually a completely killed vaccine. It is impossible to infect you with the flu from a flu vaccine. But sometimes what happens is a person gets that vaccine and they feel a little flu-like for a day or so. And that's their body's response to the flu vaccine. That's your body building antibodies and getting ready to actually fight the flu should it ever come up against it again. And so it's, like I said, it's not that the flu vaccine is giving you the flu, it's just your body's response to it. Okay, so again, please let me dispel that myth that you cannot get the flu from the flu vaccine. You need to come in and get your flu vaccine done this year. Thank you.
That's all.
That's it.
So that's it.
That's it.
I'd just like to say, just continue practicing our safe, like I said, like the hand sanitizers and stuff like that. When you come into any of our services, they're all open. Just, use the hand sanitizer, sign in, and we do our best to stay safe, and thank you.
And if you guys are in need of any supplies, so Alberta Health Services did provide the nation with a bunch of different masks. Mm-hmm. And so if you're finding that you're having a hard time getting a hold of masks, just doing your local shopping or whatever else, please come to the health center. We do have those masks available for the public. And so we can help you out with getting those masks to you directly. For the most part, we're able to supply you with quite a bit of stuff within reason. So if you're having difficulty finding some of that stuff to procure in your home yourself to keep you and your family safe, please come in and see us, or please give us a call and we'll see where we can help you out. I guess in closing, what I'd like to do is also kind of put COVID and the pandemic aside for a minute, and maybe we can just talk about an upcoming clinic here on the nation. And that is our Alberta Spay and Neuter Task Force Spay and Neuter Clinic here. And it will be here on September 25th to the 27th. This is available for our band members. It's first come, first serve. Bring your dog, bring your cat. The animals will be spayed and neutered. They will be tattooed, vaccinated, and treated for parasites. Your pet will spend a minimum of one night in the recovery unit that they'll set up at our old band hall. When dropping off your pet on Friday or Saturday, please stay in your vehicle in the parking lot. We're actually going to have a tent and a reception area set up outside, and we'll come directly to you at your vehicles and receive your pets and all of your information. We're just trying to, stay within the guidelines Alberta Health Services has set out for this team. So you can do us a favor by just staying in your vehicles. It'll be done as a drive-through to drop off your pets. If you have any questions at all, please give me a call at the health center, 780-594-2473. Ask for Lillian. And I hope that we all can make good use of this clinic. This is a huge team that they bring out here. It's what I like to call organized chaos. Like, I mean, when they come in, it is the pets get checked in, they get into their pre-anesthetic, they get the surgery done, they go into recovery. It's really quite a machine when you look at all the parts working together. So if you do have a dog or cat at home that you need to have spayed or neutered and help control our pet population, please make sure that you bring your dog down or your cat down on September 25th. That's it.
That's it.
Thank you, guys.
Thank you.